Is it recording now? Okay, I think it is. All right, thank you so much, everybody, for coming to our bi-weekly COVID meetup. My name is Amelia, and happy holidays, by the way, everybody. I can't believe it's almost the end of 2020, but I hope that everyone is staying safe and healthy and warm. So for today's agenda, here are the things that we're planning on going through. So the first thing is our 3 deep breaths. Next, we'll talk about the COVID vaccines, just general information. Then we'll talk about COVID vaccines in the workplace. Then we'll talk about COVID vaccines and the Montana update, and then just other COVID news. Of course, at any point in time, if you would like to bring up any other questions or other topics, please do feel free to do that. You can either share that into the chat box or just unmute yourself and speak to all who are present. And one just last reminder for people who have joined us just now, if you would like MSL credit for this webinar, please put your first name, last name, and library into the chat box so that I can verify your attendance in Aspen. And I'll try and remember to do a reminder at the end of this hour to let people know. So yeah, again, any questions or comments, you can please put those into the chat box and I'll be sure to address those. So the first thing is our 3 deep breaths. I put a fireplace picture here just to give us all some cozy vibes, the chestnut roasting on an open fire, heart cockle warming sort of thing. So if you just want to look at this picture, channel that energy, and then sit up straight, put your shoulders back and down, kind of lift up your rib cage, open up your bottom stomach, the diaphragm, and then we'll do our 3 deep breaths. So breathe in, breathe out, in, out, in, and out. Okay. So our first topic for today is just general COVID vaccine information. And there were a couple questions that were brought up at the last COVID meetup, asking a little bit about how mRNA technology works, which is what's used for the vaccine. And there was a question about whether or not the mRNA vaccine can affect your DNA. So rest assured, the mRNA does not interact with your DNA at all. Everything is on the surface, on the outside of the cell. It does not actually penetrate into the cell itself. And the DNA is in the nucleus of the cell. So there's no interaction whatsoever with your DNA, so it will not affect your DNA at all. I included a couple of links on here for people who would like to do some more reading, or if you'd like to share any of these links. The first two are from the CDC. So the first link talks about mRNA technology in general. As I mentioned in the meetup from last time, this is actually not new technology. This is something that's been researched for quite a long time, and there's been a lot of time and resources put into this. So just to kind of assuage fears that this isn't something that just popped out of nowhere, there's actually been a lot of foundational research and precedent behind this technology. And with the specific COVID vaccine, it was just a matter of kind of slotting that into this structure that we already had. So if you want to learn more about mRNA technology, that first link is a really good place to start and get an overview of. The second link on here is about the COVID mRNA vaccine specifically. So it talks a little bit about how the vaccine works, what the basic mechanics of it are, and that's something that you can definitely share with people. The third link that I put on here is just general vaccine knowledge from the CDC. So just kind of just vaccines in general. So in case people have questions about that, this is a great page to direct people to. It talks about a lot of the ingredients that are used in vaccines, the different types of vaccines, how they're created, how they're researched and developed, and all that. And then I included a couple of articles here, just kind of talking about uh, the rollout of the Pfizer vaccine and the Moderna vaccine. I'm sure you all have seen that Moderna was approved by the FDA for emergency use a couple days ago. So now that's being distributed to states and is being administered as well. There's also a discussion that's happening right now on the national and local level in terms of who should be prioritized for the vaccines. So I think people are mostly agreed that people over 75 and essential workers, health workers, et cetera, are first in line. But then after that, there's a lot of conversation and discussion going on as to who should come next. So this is probably going to be decided on a state by state basis, I think. I think there's probably going to be general trends that everyone follows. But there's a lot of articles about this. You can kind of read about the conversations happening. There's a little bit of consensus, but a lot of things are still being determined. So that's kind of what's happening right now. I'm sure you've also seen that a lot of vaccines have been administered, which is great. They have been sending those things out. They've been giving them to people. And so you can read, there's, I think, actually a lot of kind of, I got the vaccine articles that have come out. So if you're curious about that, you can do some searching and find that information. So I hope if there are any questions, feel free to put that into the chat box, but I'm going to go ahead and drop these links into the chat box first before we move on. Okay. If there are no questions, I will continue onwards. So the next topic that we're going to talk about are vaccines and the workplace. And so in our last meeting, we just brought up the topic of whether or not employers can require vaccines. And at that point, there wasn't really a lot of consensus. And even still now, there's not a lot of like definitive, you should need to do this sort of stuff. But I did want to bring up, so the first two articles that I've linked here are from the National Law Review and the Equal Employment Opportunity Commission. I think that's what the EEOC, yes, Equal Employment Opportunity Commission. They just released guidance last week, I think on the 17th, on COVID vaccines in the workplace. So these two articles from the National Law Review talk about that guidance and what that could possibly mean for employers. And of course, everything is very, as I said, these are guidelines. They're not rules. They're not a strict procedure for people to follow. And then this third link here is the actual text from the EEOC, the guidance that they released. So I would encourage you to read through these articles to get a sense for what people are talking about and what they're kind of considering. The main points are that employers can require COVID vaccines, and it is not classified as a medical exam. So in that way, it does not violate the ADA. So there's nothing saying that employers cannot require vaccines. But there are many issues that have to be worked out before employers can create a policy around vaccines. There's a lot of consideration for employees who don't want or are unable to get a vaccine. And so there's lots of different considerations around there. So it's not as simple as like, yes, you can do this. No, you can't do this. There's a lot of things that you have to consider. So the National Law Review articles do bring up a couple of these things, these topics to think about, and ways that you could potentially structure things or just things to keep in mind. But in general, there's still a lot of lawyers and people talking about this. I would encourage you to keep an eye out in your own communities to see what other people are doing, what the business community is doing, what your local health departments are recommending, and feel free to share with each other as well. But it's definitely not a cut and dry thing, and there's a lot to take into consideration um, if this is something that your company is interested in doing. Um, that being said, voluntary vaccinations are totally allowed, and there's nothing preventing that. If a person wants to go and get the vaccine, then that should not be an issue. And that also can be separate from an employer, whether or not that is required by your workplace or whatever. So again, still kind of a wibbly wobbly, wishy-washy kind of lots of gray areas sort of thing. But there is a little bit more information coming out about this. And I think in the next few weeks and months, there will probably be concrete examples of policies that come out. Again, none of us will probably see the vaccine for a while. I don't think it's going to be available to the general public until I think at the earliest late spring is what estimates have said. It's more likely that it's going to be like midsummer to late summer to early fall, I believe. But we will be keeping an eye out on this topic to see what information comes out, and we'll be sure to update you on that. And feel free to share anything that you all find out as well. Let's see, there's a question from Jennifer. Do we know if the state library found out if library employees are essential workers? I don't think we found anything out about that.
Hey, Amelia, this is
Oh,
Tracy.
hey, Tracy.
So I think for purposes of the vaccination, essential workers are really defined as our nurses, doctors, healthcare, EMT, fire, those folks. I know that Jenny, our state librarian, has reached out to the Department of Public Health and Human Services Task Force and has really kind of advocated for librarians to be considered in the phase where people in the education field are being vaccinated. And that's actually considered to be phase 1C. And that's in that really long vaccination plan that we shared the last time. And I don't happen to have that link handy. At this point, what others have said is that library staff would be like in phase 3, but I know Jenny and others have kind of been trying to advocate to move librarians up a little bit higher, because I think there's often this perception that libraries don't see as many people as you actually do. And so we've been trying to work on our end to get people to realize how many people you do see come into your doors and how many of you serve vulnerable populations. So I don't really have anything to report in terms of like a resounding yes, and I'm not surprised. I think they're probably being lobbied by a lot of individuals to be considered higher on the list of the vaccination plans, but that's kind of what I can report at this point.
Thanks, Tracy. And I did drop the links from this slide into the chat box if you'd like to take a look at those. And overall, I think it's a good idea to just start thinking about vaccination policies, maybe just start talking about it with your staff or with your board. Not necessarily that you have to have one, but this is a topic that I think would just be good to keep abreast on. And again, keep your ears and eyes open for what other folks are doing around you to, yeah, see what's going on with that. Any questions about that? Okay, I shall move on then. So this next slide is just Montana updates, and there's actually not a whole lot on here that I have to report. The main thing is that I've linked the Montana COVID vaccine homepage, I guess, or landing page here. So I'd actually recommend bookmarking that because any updates that they have, they will put on this page. And actually, Tracy, I think the vaccination plan that you mentioned is on that page. So let me go ahead and just drop that in. Um, and I also have a news article here from Billings KTVQ that's talking about how the Montana share of Pfizer vaccines was reduced by 20%. And Montana was not the only state that this happened. I think the federal government had given out numbers previously, and then it turned out that their available allocation was less than they had thought. So I think there's maybe 10 or 12 other states that also received reduced allotments. And I think that's just due to availability of the Pfizer vaccine at the moment. So more vaccines are forthcoming, but it's just the initial allotment that Montana was supposed to receive was ended up being a little bit less. So you can read a little bit more about that in this news article. I do know that Montana is receiving the Moderna vaccine next, and that will be designated for more rural areas because the Moderna vaccine doesn't need the super cold temperatures. I think it can be just stored at regular refrigeration. So that will just make it easier for Montana to get it out to rural areas that don't have more specialized storage facilities. So let me go ahead and drop that link into the chat box. And again, I just recommend bookmarking the vaccination homepage so that you can sort of keep up with any updates or changes that are going on. And oops, I think I did not actually post the link. So there's the Billings KTVQ link. Any questions about the Montana vaccination plan stuff? Okay. So next, I just have general COVID news. This is kind of a catch-all for stuff. So this first link on here is from the Montana Free Press, and there's a couple other news outlets that have had a very similar article on it. But Gianforte, I think, has indicated that he probably will not maintain the mask mandate when the transition happens in January, although he said he himself will personally wear a mask and will also receive a vaccine. So it is unclear at this point how this will affect things, what stance different communities and groups of organizations will take. There is the possibility that if the statewide mandate is revoked about masks, local governments and like county health departments might be able to institute it on a county level. So I haven't heard very much about that at this point, but I think that might be the route people can go if the statewide mandate is revoked. So you can take a look at that article. And if there's more information that comes out about that over the next few weeks, I'll be sure to let you know. And there's a comment from Heather. We are in the minority of following the mask mandate in our area anyway. So yeah, I think it'll be interesting to see how that plays out. But yeah, just letting you know that as of right now, it seems like Gianforte will probably not be keeping the mask mandate. The next thing is I just included the herd immunity definition on here from the APIC, which is the Association for Professionals in Infectious Disease Control, I think. I kind of forget what the exact acronym stands for. But when I was just reading a little bit on and preparing for this, I could see that there was a little bit of confusion as to what herd immunity was. And for some people, herd immunity was like an action, whereas herd immunity is actually an effect. So you can reach herd immunity through different actions. And I think that's the conversation that's happening right now across the world is how do you reach herd immunity? Some people have said you do that through vaccines. Some people say you do this through other ways. The route through to reach herd immunity is not necessarily agreed upon, but herd immunity itself is an effect. It's not an action. So just to clarify that, and you can read a little bit more about herd immunity there. I included an article from the Associated Press about the new coronavirus strains, in case you all have heard about that. So there are some new strains of COVID coming from the UK, from South Africa, from I think a couple other places too. So health officials have noticed that these new strains spread more easily, but there's not any evidence so far that shows it's more virulent. So it's not it spreads more easily between people, but it's not killing more people, fortunately. So at this point, most health officials are saying, you know, we should definitely monitor this, definitely keep an eye on it. But right now, it's not a huge cause for concern. In general, virus mutations and new strains popping up are part of a virus's normal lifespan. That's kind of a naturally occurring process. And this happens with most viruses. I mean, that's why we need new flu shots every year because there's different strains of the flu that develop each year. Um, so people are keeping an eye on this right now. There's been a lot of questions about if the Moderna and Pfizer and all of the vaccines that are happening, if those are effective against the new strains. And so far they have said, yes, it seems like it is still providing effective protection against the new strains. So that's really good to hear. Um, but of course, you know, I'll keep an eye on this. And if we hear of anything changing, we'll be sure to let you know. But for right now, they're like good to keep an eye on, but not a huge cause for concern. Um, let's see. So, oh, those are two articles that I put about new COVID strains and just kind of general COVID updates. Um, And then I put a few articles on here and links just talking about vaccine information, resources for vaccine information, and combating fake news and misinformation. So these are just really good resources to have, especially in these times. You know, I'm sure we all know that like none of us are doctors, none of us are public health experts, none of us have like the in-depth expertise to like definitively and authoritatively talk on these topics, but all the people who do have those degrees and all of that knowledge have put together really great resources, and those are the things that we should be recommending to people and directing people to, because that's where a lot of the authoritative and accurate information is from. So this is just a reminder of where you can get that information from, what you can send to people. And the last link on here from Cornell University Library is just a really great resource on if people are interested, you know, evaluating news sources and media pieces that they encounter in the wild. So that's just a really good resource to have as well in case anyone is interested in that. And oh, Beth said it's the Association of Professionals in Infection Control and Epidemiology. Thank you, Beth. I knew it was a mixture of those kinds of words. Um, so I just wanted to put this all in here so that you guys would have it in case you need it. And let me go ahead and put all of that into the chat box. And if there are any questions on this, please feel free to bring them up. Okay. And Beth said, these are great links to use on social media. Thank you for providing them. Yes, I hope that they are helpful. And if anyone else has other links that you'd like to share, please do feel free to put those into the chat box as well. There's a lot of really great resources out there, especially on critically evaluating news and media sources. Jennifer says, any idea of ingredients in Moderna vaccine? Nope. No idea. I think I don't actually know if I've read anything about the ingredients. I know that there's fat in them because that's what the mRNA is encased in. Um, and but beyond that, I have no idea. So I'll put that on my list of things to look into. I don't think I've encountered anything about specific ingredients in the Moderna vaccine, but I'll try looking and see what I find. Any questions? I think that's actually it that I had for today. um, so, at this point, we can just open it up to general questions, comments, other things that might have come up. Again, if you would like credit, MSL credit for attending this webinar, please make sure to put your first name, last name, and library into the chat box so that I can confirm your attendance later on. Otherwise, thanks for coming, and hope that you all have a great holiday season. And yeah, if you have any questions or other topics that you'd like me to look into, feel free. Let's see. Okay, from Kathleen. Honest question, not trying to cause trouble, just thinking about it. Has anyone come across any articles about why it would be necessary for everyone to receive vaccination? Why would it matter to an employer whether or not an employee receives the vaccine? If the vaccine protects those who have received one, why does it matter to them whether someone else gets vaccinated? How would they be endangering anyone but themselves? If they're not endangering others, shouldn't it be their own personal health decision, just like many other things? And I think in some cases, a lot of this I think has to deal with personal health information that maybe people aren't able or wanting to reveal to other people. There are some people who can't receive vaccines for medical reasons. There's various reasons why people do or do not get vaccines, but there are a lot of people who do rely on herd immunity to prevent themselves from getting sick because they themselves cannot receive a vaccine. And I think in the EEOC guidance that was released, employers requiring vaccines is part of providing a safe workplace for everybody. So in some cases, I think you're right in that the vaccine does prevent you from getting sick or getting super, super sick or heaven forbid, dying from COVID. But, and they're still doing research on this and it's not quite definitive how well the vaccine protects other people from not, or prevents COVID from being transmitted to other people. But I think that's the aspect that people are wanting to prevent, because even there's a level of like you getting the vaccine to protect yourself, but also if you don't have COVID, then you're not going to spread it to other people. So there's that part as well. Let's see. But yeah, and I can look a little bit more into this. And I think as more information comes out regarding employer vaccinations, that will also become a little bit clearer. And part of the conversations happening right now around requiring vaccines in the workplace is still trying to not wanting to force people to do anything. As I said, the guidance does allow for employers to be able to require the vaccine, but it's not like all right, there you go, now you can do it. There's still a lot of things that employers have to do in order to take a lot of things in consideration before they require it, and to provide accommodations for people who aren't able to receive it or might not want to receive it. And so let's see. And then Sandra said, have you heard anything about the Johnson & Johnson vaccine? I have heard about it, but I have not heard much else. And I didn't really see anything when I was Googling yesterday and today. So I will try and take a look at that next time. But it was not coming up in the results that I was looking at today and yesterday. And Kathleen said, if this is opening too big a can of worms, we don't need to look at it today. And yeah, maybe this is a conversation we can have later on. But let's see. Jennifer said, we don't know if it keeps you from passing the virus yet, just that maybe you would not get as sick. And then, yes, that's very true. So there's still a lot of articles saying that, social distancing and masks should still be in place because that part they just haven't researched as much. Hopefully that is a side effect of heightened immunity against COVID, but there's not enough evidence yet to say definitively. And then Susie said, if the governor rescinds the mask mandate and the local health department doesn't institute them, will libraries still be able to require masks? We instituted our mask policy before Governor Bullock instituted the mask mandate. Hopefully we can continue requiring masks. And I think so, Susie. I think back when we were still talking about this, I think we had equated it to like, no shoes, no shirt, no shoes, no shirt, no service. Any kind of policy that you enact on in your library, um, you know, if you pass it through your board and you discuss it and you go through the whole process, then it's a valid policy and, that is enforceable within your organization, regardless of what's happening outside. Um, so feel free to correct me on that, anyone else who remembers those conversations, but that's my impression from when we were discussing this before Governor Bullock instituted the mask mandate.
That is
Um,
correct, Amelia. Library
okay,
boards have the power to set policy for use of the library.
cool. Thanks, Tracy.
You're welcome.
And
And
Starla said, I agree, Kathleen. I'm pretty nervous about it being required to keep my job. I am allergic to the general ingredients of vaccines. And Starla, I think in those cases, so I would really encourage people to read the National Law Review information on there. I think it talks a lot about different concerns that people might have, different things that employers can think about. And again, it's not like you're getting the vaccine, you keep your job, you don't get the vaccine, you lose your job. It's not at all cut and dry like that. So I advise you to just read those articles. And again, I think this is going to be a conversation within an organization rather than, a federal sort of handed down, everyone has to do this or whatever. Um, and, oh, sorry.
Amelia, this is
Yes.
Kylie. I was just sort of doing some searching while other folks were discussing things in the chat, and I think I may have found information about what's in the Moderna
Ooh,
vaccine.
perfect.
This is a fact sheet I found for recipients and caregivers that I just shared in the chat. It's a PDF, but I got it from this website that I will also share in the chat. So I didn't memorize
Perfect.
all the ingredients, but it is down there.
Eye of Newt. No, just kidding.
Yeah. Definitely things that I would have trouble pronouncing if I tried to do it on this meeting. So
Cool. Thanks, Kylie, for finding
yeah,
those.
no
So
worries.
yeah, feel free to take a look at those links if you need to. And Kathleen said, I'm not anti-vaccine in general, but I like to evaluate and make an individual decision regarding what's best for me based on what I know about my own health. And thanks for gathering all the articles for us. You're welcome. Any other questions? And just a reminder that you can also save the chat if you'd like. You can go to the chat box and then above type message here, it should say to everyone and then file and then an ellipse menu over on the right-hand side. And if you click on that, you can save the transcript. So you can save all of these links if you would like. Any other questions or comments? Again, last call, if you would like MSL credit, please put your first name, last name, and library into the chat so that I can verify that in Aspen later on. Otherwise, thank you all for coming. I'll stay on for a little bit longer just in case anyone has any other questions. Otherwise, yeah, as Kylie said, happy, safe holidaying, everybody. I hope you all are getting a little bit more snow than Helena is. I was hoping that we'd have a bigger, a wider Christmas, but I guess not. So let me go ahead and actually stop the recording.